Hello everyone, my name is Rachel Mary and I have the honor and privilege of being able to interview my dear friend, Dr. John Bruchalski. He has an incredible testimony of being a former abortion worker. He is a man who is filled with the grace, the love, the empathy, and the compassion and the thoughtfulness of Jesus. Today we will be discussing a topic that is really close to both of our hearts, which is the topic of IVF, couples walking through infertility, and more. So thank you so much for being here today.
Oh, Rachel, it's wonderful to be with you and to all your friends out there.
Thank you.
Because this is a real, vitally important issue right now because of the suffering.
It is. And so would you mind sharing just a bit about your own journey and your own testimony?
You know, I went to a great OBGYN residency program in Eastern Virginia School of Medicine in Norfolk, Virginia. We were a really excellently well-trained OBGYN practice. We had so many wonderful professors that were world famous, but they really brought us down to caring for patients. At our center at the Eastern Virginia School of Medicine was also the Jones Institute for Reproductive Medicine. It's the home of the first United States test tube baby, Elizabeth Carr, in 1981, I believe. And I was there from 87 through 91. And I participated as a resident in the IVF program. At that time in history, we were the largest center in the United States doing IVF. We had 400 women coming to us every 3 to 4 months. So that was 1,600 women a year if you break up the year into quarters. Most places couldn't get that number in 2 years. So we saw the issue of infertility as vitally important. And because the Joneses were the ones to work with Steptoe and Edwards from Britain, we did IVF. And so as a resident, not only did I see the incredible pain of infertility, the desire to build a family, to have a child, I actually saw the cutting edge medicine at the time, technology, of how we could make embryos and help families get built. So it was both and. It was on the science side as well as the human side.
And what was kind of your conversion story of being involved in the IVF industry?
There was this incredible desire to help young women, not young women, to actually help older women have children. So because of kind of the liberation of women in the sexual revolution, the folks at Woodstock in 1968, they ended up with blocked tubes from all the STDs, gonorrhea, chlamydia, syphilis, eventually HIV, and the like. And many of those, including chlamydia, that's the silent blockage. You basically would get infected, and if you didn't get treated right away, it would block your fallopian tubes. So IVF was really created to find a way around that blockage. And most of these women were in their 30s and 40s before they found that out.
Wow.
And by the time I got there, now 35-year-olds who didn't get pregnant right away, they were coming to us. And now in the world, if you haven't gotten pregnant within 3 months, everybody says a year, but you can go at 25 or 26. Well, one is because we're seeing more and more STDs in younger and younger women because of just demographics, behavior. And the desire to have a family is now been unmoored from marriage. Mm-hmm. So you open it up now because it's a business. Yes. And now it's, if you want a baby quicker, IVF is what happens. But in that process, and remember, folks, I don't know if you understand, I don't know if you've heard, but, you collect sperm from the male partner or the donor, and you then shut off the woman's body with hormones and then re-stimulate her body to make many, many eggs. Rather than 1 or 2 eggs a month, twins and 1 babies, you give them enough medication to stimulate the ovary to make many eggs. You harvest those many eggs, and they're in various stages of growth, of maturity. And you mix those with all the sperm that you collected from whatever source, whether it's the husband, the partner, or an unknown donor. And you take all those. Now the question becomes, now we can actually freeze those embryos.
Yes.
So, but it's, to obtain one child, oftentimes you have 10 to 20 frozen embryos left behind. 7 is a low number. So there's many more embryos made than are used to have one child. When you talk about progression, during the 1990s and 2000s and 2010, we had an epidemic of preterm birth in this country, raising the money and the cost of health care, because when you have more than one child, because you've put more than 4 or however more embryos back, there's a higher likelihood that you might get twins, triplets, quads, quints. Well, how do you get that? Well, it's because you put back 5, 6, 7 embryos. And when you don't have the good science to back that up, and everybody has their own IVF site, well, I remember back at the Joneses, we limited it to 4 embryos.
Okay.
And then we limited it to 2. And now, because of all the increase in preterm birth and the cost, we now have single embryo transfer, only 1 at a time. And because the drugs have caused so much problems with the women, meaning it really affects you when you're ovulating 14 or 15 eggs at a time, well, that doesn't feel really good. And so you begin to find ways to work with a natural cycle.
Yes.
And so we're trying to work through that. But it's all about the desire, because we've lost sight that you don't treat the disease anymore. Why can't you conceive? What's the problem?
Yes.
So we're treating the desire, not the disease. And when that happens, you get into some pretty challenging situations.
Can you share a bit about just different patients' testimonies that you have of precious patients that they have come into your office? They are walking through infertility.
Sure.
And they have been told that their only option is IVF. Can you share a bit about that testimony and then what you do?
Oh, yeah. Well, essentially, as any of us know, medicine's broken. There's so much cost. Everything costs too much. You can't get seen. It's a cattle call. You can't talk to doctors. There's all sorts of issues. Medicine's bankrupting the system. And with IVF, it's all about, and once again, medicine is all about efficiency. It's about, I desire a baby because I am so frustrated and the infertility is painful. And once again, I want to tell everybody else out there, infertility is horrific. The desire to have children and build a family is written within the human heart, not religiously, but systematically, neurobiologically, physiologically, as well as psychologically and spiritually for that matter. So with medicine being focused on the service and the outcome, IVF doctors are monitored by how many cycles they do, how many retrievals and how many returns of those embryos into the human body, and what is your take-home baby rate. So you get punished for failure and you get blessed and paid.
Interesting.
So there's a financial dynamic there. It's kind of the efficiencies of medicine today. And the way we do that is we multiply the number of embryos and freeze them, or we do fresh frozen. There's all sorts of new ways to do it, but the bottom line is we stimulate you to make a lot of eggs. We then inseminate all those, and then we grade them. We only freeze the good ones.
And how do we grade those embryos?
Well, we just look at the quality of what it looks like.
And what do we do with those children afterward if they are not?
Well, you sign a contract because it's all legalese, and you allow the group to either experiment on them, to flush them, to get rid of them, or to freeze them for further use. It's just, once again, the human body becomes like a machine. And I get it, because we do want to help you have a child. So that's why I did it. That's why, now I was only a resident. I just helped them retrieve eggs. I was in the embryology lab. We had the best embryology lab in the world. That's why we were so good at what we did. We were highly qualified scientists. But when you start making life a part of efficiency and technology, you begin to blur the distinction of what dignity is.
That's powerful.
So what I'm trying to say is, what I have learned now, practicing kind of in a different way, is that I want to care for you so much that I want to hate the disease that is plaguing you. And what naprotechnology has taught us, thanks be to all the practitioners that we have now across the country, as well as Dr. Tom Hilgers, we teach you about body literacy. We educate you so you can educate us, because it's all about you, to know what your body is telling us hormonally, biologically, psychologically. And that's how we treat. We do blood work. We look at diseases. We look at a whole blood panel. What's your hormones? What's your thyroid? What's your adrenal? We go down the list. What's your ovary doing? Oh, by the way, do you know that during your menses, the bleeding, well, estrogen is rising, progesterone is not elevated yet. It may be coming down from the last cycle. Then you ovulate mid-cycle where your estrogen rises, there's no progesterone or very little progesterone left. And after you ovulate, and oh, by the way, you can identify that through vaginal and cervical mucus, you can identify when you ovulate. And seeing it or not seeing it, measuring the hormones with blood or saliva, before ovulation and after ovulation, you actually can look inside the human body and begin to identify phases. Yes, good surgery can tell us about endometriosis. You can find polycystic ovarian syndrome, which at its heart is insulin resistance. So if you treat the insulin resistance with diet, exercise, herbs, and sometimes medicine, oh my Lord, you're treating the core root of the problem. What happens if you're a little heavy? What happens if you had anorexia or bulimia early? That matters. And we just don't override it with drugs to make you have more eggs.
Yes.
We try to figure out why. Now, it might take a little longer, but in the end, it might save you some time that if you learned your body literacy, fertility awareness-based methods, the website facts.
Yes.
If we taught you that when you were 13 and 14 and you were learning your cycle, it's liberating because it's body literacy. You can help us. When you come into the doctor and you can say, hey, doc, I only have an 11-day luteal phase or a 2-day luteal phase. You may not know all the words, but your body tells you what it is. You're not ignorant. You're a woman. You can do anything you want. And you don't have to pump your body full of hormones and chemicals to stifle fertility. Now, you have to treat the infertility, so you find the disease. But once again, in the IVF world, is it a male factor? Is the sperm the problem? Can it fly? Can it squirrel? Can it move through does it fly, does it move straight? What's the number? What's the quality? Because that's what has to enter the egg in your tube to have a conception or a fertilization.
Yes.
And so what happens is that, or is it a woman's factor? Or is it a combination? As you age, and we all become perimenopausal, all of us,
Yes.
you know, you all taught me, because I learned all of this from listening to people like you women out there. I know I'm a male, but I'm a gynecologist of over 35 years. So many people would refer their friends to us because we listened, we're excellent diagnosticians, but we're good at treating disease. Now, there are times when you have to do the surgery and you have to really focus on maximizing through thyroid supplementation, which is not what remember, the world is treating a disease. Children are not sexually transmitted diseases. We want that child. We want it now. Okay, I'm doing it out of love. I want to build a family. Those are all good things. I get it. I've done it. There's no rock throwing from this dude. I can't. I understand. We understand. But I want to tell you that there are times that we can really help women conceive children by targeting the disease. And in the long run, you will be healthier. Whether we treat the insulin resistance, or we help you with your weight, or we maximize the thyroid, or we maximize the cortisol and DHEA, or whether we're able to suppress or help up or download your progesterone or your estrogen. This is what when you talk about the revolution in medicine and science and technology, just like we can operate on fetuses in the womb through, like, to fix spina bifida.
Yes.
We actually know more about the woman's body now through body literacy. You have people out there like the Creighton method, or the fertility awareness people, or the fertility care centers. You can find people who really want to help you. Now, it does work so much of the time. There is good data out there that it is actually as efficient, if not more efficient, than IVF.
Wow.
Absolutely. However, there are times when it's very hard to find the disease, and you get frustrated and you want to go to IVF. It happens. And before you go to IVF, what we always recommend in our office, because now I'm getting back to that patient story, before you go to IVF, any one of you out there, make sure you and your husband, you got to ask the question of yourself. You have to have this conversation. Are the embryos that are going to be made, whether it's 1 or 20, or are they your property? Please ask yourselves that question before you go. Do you love them or do you own them? If you love them, it's hard to freeze them. If you love them, it's hard to waste them. Because that question doesn't really get brought up. It's kind of assumed that they're not really human, like they're not really persons yet. They're not really humans. They're kind of in that pre-embryo. Well, that's been disproven through biology. And you women have taught me that it's not easy to have losses. And when you realize that, yes, I got my one child, but I had to lose 3, 4, 5 embryos in the process, it takes a toll that you may not know right away. So that question is very important. If it's your property, do with it what you want. Do it the most efficient way possible. However, it does make a difference to your psyche and to your heart, as well as to your body. Getting all those drugs pumped in because you need to make a lot of eggs is not very fun or healthy. And then you have all these other people out there, these young women, because of their makeup, their race, their IQ, their job, they're having their eggs harvested all across the country. Well, they're the ones who are not very healthy, receiving those same drugs that have a host of side effects.
Yes.
So the great hope in all this conversation, what we've tried to talk with each other about, is that really giving really great informed consent, that it's much healthier on the person to go after diseases rather than those desires, because those desires, the treatments blur the human flourishing. Yes, you may get a baby faster, but at what cost? So our advice is to find those doctors, whether it's in your state or in other states, touch base with them, the NAPRO doctors, the life-affirming doctors, people who know the fertility awareness-based methods.
Yes.
Contact FACS, contact fertility care practitioners, contact the Creighton method. There's many wonderful people out there, the Marquette method, the ovulation method Billings, the Family of the Americas, they're all there helping us learn body literacy. It's a first step on identifying those diseases that we can then treat in order to help build not just your family, but to allow the gift of life to blossom in that secret, dark place called the womb. And I just am so grateful that I learned this from you women who are so tired of being hit with hormones and chemicals that distorted the human body in such a way, even though it was done for a really good reason. And that's why I don't blame people for going to IVF. I get it.
Absolutely.
But there's a lot of walking wounded out there. Hurt physically and psychologically, leaving those embryos behind.
Yes.
We have a whole, remember, there's like a 10 to 1, 20 to 1 ratio of embryos that are frozen for every baby conceived.
And I think to myself, with what you're sharing and also just the real raw statistics of it, just that these women, they deserve so much better than what the IVF industry gives them. They deserve to understand what is going on with their body that is causing them or their husband to be infertile, and they deserve to sit across from a physician such as you, who can walk with them, who can journey with them, who can help them get
for sure.
Exactly.
You're right. And there's a lot of hope out there.
Yes.
Because usually you can find that hope when you're suffering at your deepest, darkest places. So just thank you for this opportunity. It's really been a pleasure, and many blessings on what you're doing.
Well, thank you so much for being on, and thank you.
Oh, you're welcome.
Thank you. Thank you for sharing your heart and your story, and it means so much, and I know that the Lord will use it mightily to impact lives and to give precious couples hope.